Now, with inflation at 8.6% and climbing, you're going to need some help to get back to financial safety. Call Noble Gold's experts and they will share knowledge of gold IRAs, so you won't have to worry about a thing. And if you're quick, they're giving away an incredible 1/10 ounce American Eagle gold-proof coin with every qualifying IRA or 401k rollover. You can't go wrong with Noble Gold. Call the team now at 877-646-5347 to find out more or visit noblegoldinvestments.com. Good evening. We're still reporting on the coup. Scientists in the public health agencies of the U.S. federal government are embarrassed about the bad advice entities like the CDC, NIH, and FDA have been giving the American public regarding the COVID pandemic. According to a substack post by Bari Weiss of a report authored by Marty Makary, MD, MPH, and professor of medicine at Johns Hopkins School of Medicine, and Tracy Beth Høeg, MD, PhD, scientists at these public health agencies are variously frustrated, exasperated, and alarmed about the direction of the agencies to which they have devoted their careers. Or, as one FDA official lamented, "It's like a horror movie I'm being forced to watch, and I can't close my eyes. People are getting bad advice, and we can't say anything." Specifically, this physician who insisted on anonymity blasted his own agency for backing vaxxes for children. With no solid clinical data, the agency authorized COVID vaccines for infants and toddlers, including those who already had COVID. And second, the fact that just months before, the FDA bypassed their external experts to authorize booster shots for young children. Remember, covering this was the very issue that got us booted off YouTube, including our entire 4,000-plus YouTube video collection created over a span of 17 years. More than half of those were put up with zero financial incentive or backing. According to Drs. Makary and Høeg, many of the senior scientists have left NIH's Vaccine Research Center rather than have to support this nonsense, including the director, deputy director, and chief medical officer, all within just the last year. According to one anonymous NIH scientist, they have no leadership right now. Suddenly there's an enormous number of jobs opening up at the highest level positions. Why? Because they know that all this will soon come to light, and then it will become apparent that the lives of millions of American children have been unnecessarily sacrificed for purely political gain by intimidating the scientific staff of these agencies to support what is overwhelmingly bad science. According to one CDC scientist, the heads of their agencies are using weak or flawed data to make critically important public health decisions. That such decisions are being driven by what's politically palatable to people in Washington or to the Biden administration. First came the demand that children had to be masked in order to attend public schools. However, compelling studies later found that masked children had no different rates of transmission. And for social and linguistic development, children need to see the faces of others. Then came closing down schools entirely. This must have made the Chinese Communist leadership thrilled by their success. According to the CDC scientists, the agencies were wrong and catastrophically so. Poor and minority children suffered learning loss with an 11-point drop in math scores alone and a 20% drop in math pass rates. There are dozens of statistics of this kind. Then they ignored natural immunity. Wrong again. The vast majority of children have already had COVID, but this has made no difference in the blanket mandates for childhood vaccines. According to another high-level CDC source, there's been a large amount of turnover. Morale is low. Things have become so political. So what are we there for? Another CDC scientist said, "I used to be proud to tell people I work at the CDC. Now I'm embarrassed." and another recounted her shame about what happened to American children. CDC failed to balance the risks of COVID with other risks that come from closing schools. Learning loss, mental health exacerbations were obvious early on, and those worsened as the guidance insisted on keeping schools virtual. CDC guidance failed this generation of children. Why are all these sources insisting on remaining anonymous? As one FDA official told Makary and Høeg, "I can't tell you how many people at the FDA have told me, I don't like any of this, but I just need to make it to my retirement." The FDA's two top vaccine regulators, Dr. Marian Gruber, director of the FDA's vaccine office, and her deputy director, Dr. Philip Krause, quit last year over political pressure to authorize vaccine boosters in young people. According to another NIH scientist, there's a silence and unwillingness for agency scientists to say anything, even though they know that some of what is being said out of the agency is absurd. Another FDA staffer told Makary and Høeg that anyone who even spoke freely within the agency would be labeled. If you talk about it, you will suffer. Whatever happened to bold physicians willing to take risks in pursuit of the truth? Unfortunately, the American people, once they discover how the truth has been suppressed, will not forgive modern medicine for generations to come. Remember the COVID. That will be the future battle cry of our children, who will likely have to suffer the worst of the consequences of this dishonest, even corrupt, response by team medicine. I'm still reporting from just outside the citadel of world freedom. Good day.